Hi, this is Glen Halvorson M.D. Welcome to Start Clinic Gym. I'm here in our medical clinic. I'm medical director of Start Health Sciences, and I want to talk to you today about a specific application of G2 pain cream. It's a fantastic topical pain cream that I formulated. Felt that there was a tremendous need in chronic pain and sports medicine for a topical product that not only temporarily relieves pain, but also promotes healing by directly influencing the underlying inflammation and swelling whenever you have an injury. Our clinic here has our own gym. It's unique in that sense. We've trained athletes at the high school, college, professional, and amateur level, helping them to achieve their performance goals. I have about 40 years of experience in sports medicine and chronic pain management. I'm a former volunteer physician at the University of Arizona. I was director of sports injury clinic at Student Health Services. I've had the great opportunity and privilege of being a volunteer physician at the Olympic Training Center, where I was assigned to judo, wrestling, and powerlifting in my early 40s. I fell in love with powerlifting. As you can see in the background here, we have power racks, Olympic weights. We also are advocates of kettlebell training. Anytime you do any high intensity type of training for athletic performance, you're going to have the risk of injury, whether it's a pulled muscle, whether it's a sprained ligament, tendonitis, joint inflammation. There are a number of different products that come and go on the market to treat some of those issues, as well as to interrupt the pain process and hopefully help prevent you from ending up with a chronic inflammatory condition. For the most part, to be honest with you, I found a lot of those products are very disappointing. Most of the products temporarily relieve pain by what's called the counter-irritant effect. In other words, if I put a topical cream, such as our G2, on my skin and rub it into the area of injury, the menthol, the essential oils will send sensory messages to the brain to block temporarily the pain messages from the underlying injury. The problem with many of the products on the market is they contain salicylates, aspirin, non-steroidal anti-inflammatory medications, anesthetics like lidocaine, and if taken excessively, these can be potentially toxic, as well as some of the herbal products that cause allergic reactions. So in formulating G2 pain cream, we wanted a product that was all organic, that not only addressed the counter-irritant theory of temporary pain relief, but also specifically addressed resolution of underlying inflammation, swelling, and facilitated the healing process. So that's what we have here in G2 pain cream. I'll give you myself as an example. I have torn rotator cuffs. They're partial tears, so I'm not at this point a surgical candidate, but I was developing progressive pain. I lost range of motion. It was interfering with the important things in my life, golf and weight training. And I went through cortisone injections, PRP, physical therapy, ultrasound, electrical stim, pretty much the whole gamut of modalities. I also tried some of the compound pharmacy prescription pain medications and also non-steroidal anti-inflammatory medications. I got some improvement, but I never got to the point where I was able to train without a certain amount of pain. When we developed G2 pain cream, I felt we had a great product, but to tell you the truth, I was a little skeptical about it helping a problem like a torn rotator cuff. So it was really, to my great amazement, that within 6 weeks of daily application, that I had got back my range of motion because I was no longer inhibited by pain. I was able to train, doing powerlifting again, doing clean and jerk, doing military presses, hitting hundreds of golf balls without discomfort. So what I do with G2 is I put it on my shoulders before I play golf. I put it on my shoulders before I go to the gym, and it's helped me basically manage a certain problem that may never completely go away. In other words, G2 pain cream is effective. It's not a magic potion of any kind. It's not going to heal my torn rotator cuffs, but it is going to relieve discomfort to the point where I can do everything I want with a minimal amount of discomfort. I've also had 6 knee surgeries. So I'm a professed jock. I've played a lot of sports, and unfortunately, the golden age is a pile of crap, quite frankly. I remember one patient saying that the reason it's called golden is you got to have a lot of gold to take care of all the injuries you end up with as you age. So I have arthritis in my knee. You wouldn't think that a topical would have any effect on arthritis, but it does, because arthritis always causes joint inflammation. It may cause some swelling. I've had multiple joint injections. I've had some of the cartilage injections in the knee. And so what I do with G2 is I put it on my knees, and then I put a nylon sleeve on the knee to keep it warm, and I'm able to do my powerlifting. So here I am at the age of 70, and I'm still doing squats and bench press. I'm doing clean and jerk up to 3 days a week. And it's been a part of my lifestyle. G2 has helped me achieve that. So what's unique about this product? First of all, it's all organic. It's made in a facility that does not manufacture any products that contain chemicals or irritants. Secondly, it's unique in its formula. It's the only product that I know of, in fact, probably the only product in America, that contains our body's master antioxidant, glutathione. A brilliant chemist discovered a way to take liquid glutathione, stabilize it in a pain cream. This has to be in an airtight container, and so it's dispensed with a pump, because if it's exposed to air, it's going to oxidize. So, for example, after several applications, if there's any of the pain cream that's left on the dispenser, it will turn brown within a few hours because it's rapidly oxidized. In addition to the glutathione, we have, the reason it's called G2 is G is for glutathione, 2 is for 2 additional powerful antioxidants that we put in there. Why do we put antioxidants in a pain cream? Because obviously the pain relief initially comes from menthol and essential oils. And keep in mind that these are ingredients that are also non-toxic. So it doesn't matter whether you're a child or adult, whether you're young or old, you can take the product without any fear of having an adverse allergic reaction. So the purpose of the antioxidants is to penetrate the skin, to scavenge free radicals in the area of inflammation. Part of the inflammatory response when you have an injury involves free radicals that come in. But if your immune system is overactive, then you end up with too much inflammation, you end up with swelling, you end up with pain, it inhibits your function, your range of motion, so you end up with muscle weakness, you end up with joint stiffness, and that can lead, without appropriate acute intervention, that can lead to chronic dysfunction. And that's another part of the reason for doing this is I do nerve conduction studies in pain clinics. So I'm seeing all these chronic pain patients who are on opioids. And there's an opioid epidemic in America now. I'm not going to I don't have the answer, let's put it that way, to the opioid epidemic. However, I do know that if you were treated appropriately in the acute phase, you may never get to the chronic phase where you even need an opioid. And you're saying, well, most of the opioid patients are neck and back pain. That is true. But we even have people with neck pain who are sleeping through the night now that required CBDs, marijuana, in order to sleep at night. We have several patients with chronic back pain who've had more than one back surgery that will call me up and say, Dr. H, I love the pain cream. My 93-year-old mother loves the pain cream. And she's, well, she's a very smart woman, and she's very critical, and she's just not going to accept her son's word for it. But she actually called me this morning and said, I'm ordering more of the pain cream. I'm getting some for all my friends because this stuff really works. So anyway, what the antioxidants do is they promote healing by reducing that inflammatory response, reducing the swelling, and promoting restoration of normal function. That's why we've trademarked not only G2 pain cream, we've trademarked Relief and Restore, because that's our byline, that's our motto, if you will, is that we not only want to relieve your pain, we want to restore normal function. You're not going to get that with most of the over-the-counter products. They simply provide temporary relief of pain, and that's about it. Now, the antioxidants that we put in there include a special acetate form of vitamin C. Vitamin C itself does not penetrate the epidermis. So all these cosmetic products that have vitamin C in them, it's almost a joke, except that the vitamin C works very effectively as a lightening agent for the skin, but it does not penetrate the skin. So we have an acetyl form extracted from vitamin C. It's very expensive. It penetrates the epidermis, and it functions like vitamin C in the underlying tissue. So, and then of course we put in there my favorite, OPC, oligomeric parenthylcyanidins, are polyphenols that are found in many different plant sources, but most abundantly in grapeseed extract and pine bark extract. If you go to your health food store, the pine bark form of OPC is called pycnogenol because it's trademarked. The grapeseed may be a variety of different forms, but we took a highly expensive form of it that comes from one of the companies in Italy that has a 30-year reputation of manufacturing quality products, so that when we get OPC from them, it's the real stuff. It's not cheap grapeseed extract that comes from places like China. So it's actually a product that works, that's based on real science. There's 40, 50 years of science on OPC as one of nature's most powerful antioxidants. The beauty of OPC is it not only is an antioxidant that helps the glutathione, as does the vitamin C. They both make the glutathione more effective, but it also has vascular protective properties. It increases strength of collagen in your small capillaries, which are the tiny blood vessels. It promotes collagen repair, as does the vitamin C. And we also have MSM. MSM is popular in pain products because it's a sulfur-containing compound. So it has extra sulfur bonds that will also neutralize free radicals. So overall, it's a great product to not only provide temporary relief, but hopefully if you use it long enough, it'll help with restoring normal function. When I say long enough, I'm really talking about the normal amount of time it takes to heal most soft tissue injuries, which if you don't keep beating yourself up, it's going to be 6 to 8 weeks. So if you do get the G2 pain cream, make sure that you apply it daily, probably at least twice daily, that you give it at least a month or two trial before you make a decision as to whether it's effective for you. Thank you for listening.